Let's go through a basic urine analysis, a UA, and what all of these markers mean. Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor practicing in the state of Minnesota. So in a basic UA, the markers that you see will roughly be separated into three sections: the physical exam, the chemical exam, and the microscopic exam. I'm going to focus a little bit on the physical exam portion in this video, but the next video will be on the chemical exam, and the video after that will be the microscopic exam. So the physical exam is the specific gravity, the pH, and the color and clarity of the urine. What the specific gravity means is how concentrated is your urine, how good at concentrating your urine is your kidneys. This reflects the hydration status, but could also indicate things like your kidneys' ability or your hormonal regulation in terms of how that is signaling your body to concentrate your urine. So the normal range is between 1.003 and 1.030. Anything below that suggests overhydration or some condition in which you aren't able to concentrate your urine, like diabetes insipidus. Anything over that suggests that you are either dehydrated or there's something going on where you are overly concentrating your urine. So things like syndrome of inappropriate antidiuretic hormone release would be like that. That is abbreviated SIADH. Now we're going to go to the pH. So pH does vary with diet and metabolism, and in a broadly normal sense, anywhere between 4.5 to 8 is considered normal. Although if you have alkaline urine that is constantly over 7, then that can indicate some more urease producing bacteria that might be growing in your urinary tract, or you have something called renal tubular acidosis, which is also something that should be worked up. Now, if you have acidic urine that is constantly acidic, likely lower than 5.5, this can predispose you to more uric acid stone formation. So if you are a stone former, you would want to keep your urine pH a little bit higher than that. Now let's go to color and clarity. So this is a subjective examination by the person who is doing this test. They will usually describe the color and whether or not it's clear or cloudy, or if it has any qualities like frothy, or if there's like anything floating around in it. So cloudy urine is generally not as normal. It can be precipitated crystals that are in there, especially like phosphate crystals in alkaline urine, or it could be an infection in which something's going on further up the kidneys that's making the urine cloudy on its way down. If the urine is really frothy, that does suggest that there's more protein content in the urine, which can mean that there's glomerular damage further up in the kidneys, in which the kidneys aren't filtering the protein out of the urine quite as well, and that also warrants further workup because that's not supposed to happen. And conditions that can cause too much protein in the urine are usually conditions that cause a lot of damage to the glomerular filtration up in the kidneys. So this could be diabetes, this could be a nephrotic syndrome, it could be some sort of glomerular disease or autoimmune condition. So that does need to be worked up further. So yeah, these are the 3 points of physical exam in a basic UA, a basic urine analysis. And in the next video, I'm going to talk about the chemical portion of things. Hope this helps.